Good morning from the Oklahoma Insurance Department. My name is Wyatt Stanford, and I work in the Communications Division at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding a claim. If you would like to reach out to us for help or if you have any questions, you can call us toll free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you'll be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it into the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, now over to you.
Good morning. Hope everybody had a great 4th of July weekend. Wyatt and I were just sharing. I did nothing. I didn't go anywhere. I did no 4th of July celebration. I ate no 4th of July food. I don't know why. It wasn't like a protest or anything. It was just a wonderful opportunity to just sit very still and do nothing. I was actually house sitting for someone, and I just sat there and took care of their pool and house sat for their dogs, and it was wonderful. So without any further ado, let's go ahead and get started. Hopefully everybody can see my screen, and wanted to remind everybody that these webinars are being brought to you thanks to the folks at the Administration for Community Living through grants that they supply to us. The SHIP grant, the S&P grant, and the MIPA grant, which give us funds to go out and educate folks on Medicare and how Medicare works and what are the parts of Medicare and all that good stuff, as well as how to protect yourself from becoming a victim of Medicare fraud. So today's topic is going to be prescription drug coverage. Not just how Medicare covers it, but there's a lot of moving parts to this particular topic, and it gets very confusing for people. We get a lot of questions about this, both from people who are on Medicare and people who are about to be on Medicare. So hopefully this is going to help some people answer some of your questions. Again, our webinars are only 30 minutes. I doubt that we'll answer everybody's questions, but at the end, of course, there'll be phone numbers for some places where you can go to get more information to answer those questions. So let's talk. If I'm on Medicare, what's covering my drugs? Well, part of that has to do with where you're at the time you're getting those medications. For example, if you're in the hospital at the time you're getting that medication, maybe you've had surgery or God forbid you were in an accident or something and you're getting treatment in the hospital, those medications are probably going to be covered by your Medicare Part A, because that's what covers your care while you're in the hospital. But let's say that you're in the doctor's office and you're getting some sort of injection or infusion treatment or something like that. Probably those medications are going to be covered by Medicare Part B. But if you're at the doctor's office and that physician writes you a prescription and sends you to the pharmacy for you to get your prescription filled at the pharmacy, then good chance that that prescription is going to be filled by Medicare Part D, the prescription drug program that's the newest part of the Medicare system. And these are plans that are offered through private companies that contract with Medicare to cover these prescription drug plans. And we're going to talk more about those as we go along. Now, some people choose to get their Medicare through Medicare Advantage plans, also known as Part C. And the majority of those Medicare Advantage plans include the prescription drug coverage. So for those people who are on those Medicare Advantage plans, they don't get a separate Part D plan. They're going to get that prescription drug coverage through that Part D. Not in every case, but in most cases. Now, here in Oklahoma, we've got 17 different plans that are available to us. That's down a little bit from what it was last year. And the premiums, the monthly premiums for those plans ranged this year from $0 all the way up to $122.30 per month. And what varies about those plans is the drugs that those plans cover. The deductible for those plans also varies. Some plans don't have any deductible, but the most that the deductible can be for those plans is $590 a month. The maximum out of pocket for any prescription drug plan, for any plan in the United States for a Part D drug plan is $2,000 starting in 2025, which means no more donut hole. Up until now, every year, whenever we've talked about prescription drug plans, we've always had to explain about the donut hole, the coverage gap that existed with the Part D plans. But beginning this year, there is no more donut hole. Everybody, once their out-of-pocket costs reach that $2,000, that's it. We're going to talk more about that. So when you've got a Part D drug plan, you've got different phases that you start out in. The first phase is going to be the plan deductible. What is the deductible? The deductible is the amount you pay each year for your prescriptions before your plan starts paying. So as we said, the maximum the deductible can be this year is $590. That's the most it can be. Some have a $0 deductible, some have $250 deductible, but the most it could be on any plan is $590. Now, on some of the plans that have a deductible, there are certain drugs that aren't going to have the deductible isn't going to apply to your drugs. For example, insulin. If you're on insulin, you're not going to have to worry about meeting your deductible before your plan pays for that. You're going to pay $35 for that insulin, and you don't have to meet your deductible first. And there's going to be other drugs that might be in that same situation. So when you're actually doing your drug plan comparison with your counselor, it's going to be important that you actually look at each one of the medications that you're taking to find out if you're going to have to meet the deductible for each one of those medications before you have to actually, before you're paying the full amount or the amount, the reduced amount that your plan is kicked in. So then after you've met the deductible, you go into the coverage phase, phase 2, at which point in time your plan is going to pay approximately 75% of the cost for those covered drugs. And how much the plan pays depends on the tier level assigned to your medication. So your plan can have different tiers for the medications that you're on, a tier 1 drug, a tier 2 drug, a tier 4 drug, et cetera, et cetera. So let's say that now that we know that there's a $2,000 cap on how much that you're going to have to pay, and if you're going to have to pay 75% of those drugs, let's assume that you're on a plan that's got that $590 deductible for your medications, and you've met your deductible. That's going to leave about $1,410 to meet that $2,000 cap. So you're still going to have roughly $353 worth of out-of-pocket costs before you're going to hit that $2,000 cap. So that gives you an idea of what you've got left before you're going to meet that $2,000. Now, very quickly, let's talk about copays versus coinsurance. Some of your plans are going to have copays, some are going to have coinsurance, some may have both. What's the difference between a copay and coinsurance? A copay is a set amount of money, could be $20, $25, etc. Coinsurance is a percentage, all right? So if you're paying a copay, if you're getting on a drug plan and you see on the comparison that it says that that particular drug has a $20 copay, that means for that year, that drug is going to cost you $20 every time you go to get that refill per month. If it says co-insurance, that means that amount could change on a monthly basis, because if the amount that the drug plan has to pay for that drug changes, then so does the amount that you have to pay when you pick up that prescription. For example, let's say that you're on a medication that your plan has to pay $300 a month for. Well, if your copay is $25 a month, then doesn't matter. You're going to go in and pay $25 a month for the rest of the year. But let's say that you're on a plan that has a coinsurance, and let's say that your coinsurance has a 10% coinsurance. Then your 10% coinsurance would be $30 to begin with. But let's say that that same $300 drug goes up to $320 a month. Well, then your coinsurance, would go up to $32. Or if it went up to $350, your coinsurance would go up to $35, etc. So it's just something to keep in mind. Now, once you and your plan have spent $2,000 combined, which also includes the deductible, you have met your out-of-pocket costs for that year. Now, what if you've got other coverage besides your Medicare? It's important that you understand how that prescription drug coverage coordinates with that other, with your Medicare, because it's going to be different in every situation. This is called coordination of benefits. It's the process of determining the order in which these multiple insurance carriers, including your Medicare, pay for a person's healthcare expenses. So let's say you've got employer coverage. Let's say that you're still working and you've got health insurance coverage through that employer, but you've also got Medicare coverage. Or let's say maybe you're the spouse of somebody who's still working and you've got Medicare, but they also cover you under their employer coverage. Now, who pays first is going to depend on the size of that employer. If that employer has 20 or more employees, the employer coverage is going to be your primary payer, both for the health insurance coverage as well as the prescription coverage. Now, if the employer has fewer than 20 employees, then Medicare is going to be primary and the health insurance coverage is going to pay secondary. Now, where this becomes critical is if you're with an employer that has fewer than 20 employees, it's going to be very important that you've got that Medicare coverage in place, including your Part D coverage, because the employer coverage is not going to pay primary if you're eligible for Medicare. You need to have that employer coverage, or you need to have that Medicare coverage in place, because probably that employer coverage isn't going to pay at all, or if at all, it would only pay as secondary. So if the beneficiary in question is on Medicare due to disability, some of this is going to change. The threshold for the number of employees goes up to 100. So in that example above where you see the number 20, insert the number 100 if the person in question is on Medicare due to disability. What about retiree coverage? Let's say this person is no longer working, but they're on retiree coverage because they're not working anymore. They've gone fishing. If you've got retiree coverage from your previous employer, you want to make sure that you understand your coverage. In most situations, by and large, Medicare is going to be your primary health coverage and your primary prescription coverage. And that Medicare Part D is going to be the main one, and that any employer coverage that you have for prescriptions is going to pay secondary. So it's really important that when you're looking at drug coverage every year, that you're doing a review to make sure that the Part D plan you've got is covering all your prescriptions. What about TRICARE for Life? TRICARE, is the insurance for active duty military personnel and their family. And when they retire, it becomes TRICARE for Life. People who have TRICARE for Life don't need a Part D plan. The prescription drug coverage that's offered by TRICARE for Life is considered creditable drug coverage. So you don't need Part D. Now, there are some people that take out a Part D plan for some reason or another, and that's okay. There are some situations where getting a Part D plan could be a big problem. You're not really supposed to have other insurance with some forms of retiree coverage. But with TRICARE for Life, it's okay. You can do it. And in most situations, that Part D coverage would be primary to your TRICARE for Life coverage. What about for veterans? This one's really different because VA and Medicare don't play nicely together. VA only pays within the VA system, including the pharmacy coverage. Medicare only pays outside the VA system, not inside the VA system. So the two do not coordinate with each other. Now, this used to be a bit more of a problem for those who utilize the VA system, but now VA coverage is a little bit broader. They've got mail order and things like that. So for those veterans who live in areas where there may not be a veterans pharmacy close by, it's not as big of a deal for them. Now, VA coverage is considered creditable drug coverage so for those people who don't take out a Part D drug plan, and maybe later on decide they do want to get one, that's fine. They don't have to worry about a Part D prescription drug penalty. They can hold off and not worry about it. Now, for veterans, keep this in mind. Having a Part D plan is a choice. They don't have to have one. They can rely on their VA coverage, and that's just fine. Let's talk very quickly about Indian Health Services or tribal coverage. This coverage is always the payer of last resort, even behind Medicaid. If you've got drug coverage through Indian Health Services, you do not have to have a Part D drug plan. IHS drug coverage is considered to be creditable drug coverage. However, some things to keep in mind. The IHS drug coverage may not be as robust. It may not be as comprehensive as the coverage you could get through a Part D drug plan. So you might want to consider getting a Part D plan because it might give you broader drug coverage to give you better drug coverage at more places, depending on where you live. Maybe it gives you the ability to go to more pharmacies or something. The other thing to keep in mind is by having a Part D drug plan, that brings money into the tribal system. Rather than IHS having to put money out to pay for that medication, that brings money into the tribal system so that they can use that money to make improvements on the clinics and things like that. So it's just something to think about. Now, I mentioned Medicaid a minute ago. Something that needs to be thought about very, very, very closely is once a person becomes eligible for Medicare, whether that's because they've been on disability or because they're aging into Medicare, whatever the case may be, they need to be aware of the fact that once they're eligible for Medicare, and that's eligible, not on Medicare, once they are eligible, Medicaid is not going to pay primary anymore. We've had a lot of calls from people who are suddenly shell-shocked when they go to the pharmacy or maybe it's the doctor or whatever, and they find out that, whoa, Medicaid is popping up as being a secondary payer. So it's very important that people are paying attention to when they're eligible for Medicare, whether that's Part A, Part B, or Part D, because they want to get signed up well in advance so that when they are, whatever the date of eligibility is going to be, those systems are in place and those payers are ready to begin paying as soon as they can so that you've got your Medicare ready to pay primary and then Medicaid will pay secondary. You're not losing your Medicaid, it's just going to become your secondary payer. Now let's talk about another program that's out there. Some people don't have Medicaid. They make too much money for Medicaid, but there are other programs and assistance programs that are available for people that are over that income limit, but that can also offer assistance in helping pay for their Medicare expenses. One of those that focuses specifically on prescription drug assistance is called Extra Help. And you'll see here's the income and the resource limits for 2025. These limits do change on an annual basis, and these went up a little bit for 2025. If you qualify for this program, this is going to pay all or part of your monthly premium, and it reduces the amount that you pay in copay significantly for your medications. So it really doesn't matter how much the drug costs. This is going to reduce how much you have to pay out of your pocket for that medication. So it really does make a huge difference in your out-of-pocket costs for your medications. Now, there are 4 benchmark plans. That means there's 4 different Part D plans that a person could enroll in here in Oklahoma and have a 0 monthly premium uh, and not have to pay anything for a monthly premium for their Part D coverage. And they would only pay $4.90 for generic drugs and $12.15 for brand name drugs. So that makes a big difference. Now, for some people, let's say that you've got a lot of health conditions that are going on, and none of those 4 benchmark plans cover all of your prescriptions. And you really need to be on a plan that actually has a higher monthly premium than one of those plans. You can still get on Extra Help and enroll in one of those more expensive plans, and Extra Help can still help you because there's a benchmark premium amount of $49.75 that can be applied to the monthly premium for that more expensive plan. In other words, they will reduce that monthly premium by $49.75 for 2025, and it reduces that monthly premium. So it's still a big help for those people who have to be on a more expensive plan. So some other benefits of Extra Help. One, there's no late enrollment penalty. Some people don't get on Part D because they just feel like they can't afford to get to pay for their prescriptions. They just don't think that they can afford anything. So they delay getting on Part D, and then they realize there's a late enrollment penalty, and it just sort of snowballs from there. Well, good news. If you do qualify for Extra Help, that eliminates the late enrollment penalty. The other good thing about Extra Help is sometimes when we're over 65, we go to the doctor in the middle of the year, the doctor prescribes a new medication for us, and guess what? Oh my gosh, that's not on the Part D plan that I'm currently enrolled in. What am I supposed to do? I can't afford this new medication. Well, good news. If you're on a Part D plan and you're on Extra Help, you have a special enrollment period, and you can enroll in a different Part D plan that might actually cover that prescription once per month. So you can actually switch every month to a different plan if you need to, and get on a different plan. This is actually a change from last year. And this has changed a few times over the years, but starting this year, you've actually got a once per month opportunity to switch to a different plan. So how do you get enrolled in Extra Help? Well, there's a website on socialsecurity.gov where you can go to and apply for Extra Help. There's another website that's available through the National Commission on Aging, NCOA, benefitscheckup.org. And on that website, it's not just talking about Extra Help. There's a lot of different programs out there to assist people who are low income. And on benefitscheckup.org, they talk about a lot of those various programs that are out there. So that's a great place to go and learn about various programs that might be available to assist people. Now, there's a publication, Understanding the Extra Help with Your Medicare Prescription Drug Plans, and there's the link to it there on the page there. That was just updated February 2024. Now, if you'd like some help with this and you need to talk to somebody, there's a couple of different options here. We've got one of our grants, which is our MIPA grant. We've got some funds that give us the opportunity to help people with this. You can contact our program, the Medicare Assistance Program, and there's our phone number and our website. And our partner agency is Oklahoma Human Services, and the folks there are Medicare and Medicines Program. And there is their website there if you want to go to the website. But they've also got a handy little map. I don't want to switch too quickly on you, but I am gonna. This is their map, and they've got the state divided up into these quadrants. And if you look there and you look at the color of the map, and maybe you're in a different county, and then you look there to the left, you can see the color for the county that you're in, and you can call that phone number, and they've got a counselor that can assist you with in getting doing the application for extra help, or with some of the other programs that might be available here in Oklahoma to help you with your Medicare related costs. So by all means, reach out to them. You can reach out to us at MAP, and we would be happy to help you with that information. If you know somebody who might reside in one of these counties that you think might qualify for this assistance, take down the information for their county and send them the phone number. We really want to make sure that everybody that might qualify for this is at least trying to apply. And for some people, they may have applied before and they didn't qualify, but maybe they do now. You can apply as many times as you need to, and there's no cost for applying. So please, let's make sure that everybody that can is attempting to get this assistance. Now, also wanted to point out to you, these are agencies that we contract with around the state, and the counties that they serve. That's got their phone number there. So please feel free to reach out to those folks as well. They can do assistance with applying for extra help. They can also assist you with questions you've got about Medicare and enrolling in Medicare, questions about Medicare Advantage and Medicare supplements, as well as assisting you with any questions you might have related to Medicare fraud. So now, if we've got any questions, I will ask Wyatt if he's seen anything.
So far, no questions.
Okay, if anybody's got any questions, please feel free to open it up. I know that one thing that I did think of that I didn't mention that does come up from time to time is, I'm going to stop sharing, is COBRA. Sometimes people will stop working and they have the ability to keep their work coverage for, a set amount of time after they've stopped working for them and their family. It's the same coverage they had while they were working. The only difference is now they're paying 100% of their premiums for that employer coverage. And at some point, those people may become eligible for Medicare. And I've had people say, so which is going to become, which is primary in that situation, COBRA or Medicare? In most situations, once you become eligible for Medicare, your COBRA is going to end. COBRA does not coordinate. COBRA is going to say, oh, now you've got Medicare, we're out of it. So that situation does not typically come up. Now, on a rare situation where they might temporarily overlap, then your Medicare is going to be primary and COBRA would pay secondary. But by and large, once you're eligible for Medicare, COBRA is going to bow out. So let's see here. Any questions?
Looks like we got one in the chat. It says, so it sounds like Medicare and Medicaid have different additional assistance programs.
They actually are the same because they work together. The programs themselves, they're not really separate. So not really. Extra help is is a combined program. I don't think that there are two separate assistance programs. I'm not aware of any that are separate. Anybody else? I don't see any. Okay. Listen, guys, I thank you so much for joining us after this holiday weekend. I have really enjoyed it and hope everybody has a great week. And I look forward to seeing you next month. So, everybody, take care.